Okay, so Mike, you are going to be joining us for our upcoming speaker series on June 10th and 11th, focusing on strategies to live a longer and healthier life. People can reserve tickets for this event, which will take place in four cities, so Woodburn, Salem, Dallas, and Stayton. To start, just give me an overview of what you plan to address during the speaker series.
Megan, thanks so much for the opportunity and the question. Everybody nowadays is talking about lifespan and they're starting to talk about health span. I want to bring to the audience the opportunity to understand health span, the length of time that you can live functioning, having fun, being free, active, and not require assistance. And I want to do one thing that's different than what everybody else is talking about in these sectors, and that is to help the audience see that they have choices. And choice is really the main differentiator between whether someone's going to stick with a plan long term or really be engaged in it. So that's one of the big things is that we want to talk about choice.
And so, what do you mean by that? What could that look like?
Well, that can mean a lot of different things. And you can understand that when an individual says, "This is the time I like to go to bed," or "This is what I mean by physical activity," or "These are the foods that I think feel healthiest for me," it's actually received by the body much more completely and mentally much healthier because we have established belief. Megan, we all know about the concept of what a placebo is. And we also kind of understand what the placebo effect means. Placebo effect means when you have belief in something, it increases the efficiency, the effectiveness of that activity. And what we want to do is help people use their choice, their belief, and their autonomy so that evidence-based activities and considerations of levers that you can pull for your life. When you believe in one, you increase the placebo effect, you make it more effective, you start to see changes, you stick with it, and you create an identity of I'm a walker, I'm a healthy person, I'm an active individual, I go to sleep at this time. And now you have long term change that can be adopted.
I know your book is going to be the basis of this conversation, The Brain That Chooses Itself. And in that book, you know that there are five factors that play a major role in health span. So, physical activity, sleep, nutrition, social connection, and the health benefits of extreme experiences. So, tell me what you mean by that.
Well, the extreme experiences can also be known as doing something that just puts you slightly outside of your box or slightly into your outside of your comfort zone or a degree of novelty. Now, we all know that we've heard that learning a new instrument or parts of a new foreign language is healthy for us cognitively. What we haven't actually fully appreciated are all the different plays that you can make by doing something that puts you slightly outside of your comfort zone. So let's elaborate on a couple. So you can think maybe the next easiest thing to consider is, well, I'm going to exert myself just a little bit harder. I'm going to walk my dog, but for part of that walk, I'm going to try to pick it up a notch and I'm going to exert beyond my typical level of comfort. So doing that actually pushes your body towards something healthier. Well, in fact, every different attribute that you talked about there, Megan, can benefit from doing something that's just a little bit challenging and a little bit difficult. Let's take, for example, we already did exertion. So trying to give yourself a little bit greater period between meals, time restricted feeding, intermittent fasting, that actually causes you to increase your brain's alertness, increases your acetylcholine, and also helps your whole digestive processes and drops your inflammation. But in fact, there's more than that. So people have heard about taking ice plunges or being in a sauna or a jacuzzi or a hot tub. Actually, thermal extremes help us in a very different manner as well. Also, dropping inflammation, increasing cerebral perfusion, cognitive performance. And I'll give you one nice thing to end on. In that realm, it'll shock a lot of people to know that if your doctor and medical team says it's healthy for you, being in a hot tub or a sauna for 20 minutes gives you the same exact experience as performing endurance exercise for that same length of time for your cardiac and cognitive health. So, just these extreme experiences, small attributes of them, give us dramatic mental health, cognitive health, and physical health attributes.
And going back to this concept of health span, why is it important to be talking about this at any age?
Oh, wow. Okay, so here's what's really interesting. The United States, from the years 2001 to 2019, our lifespan increased by more than our health span did. And that's across men and women. So, what does that mean? That means the US is burdened with greater numbers of years of disability. So if you can imagine, people are living 13 years longer than they did in 2001, but they're only living 10 years healthier than they did in 2001. That means for every person living longer, 3 more years of disability on the healthcare system, on the US economy, on the GDP, and on that person's quality of life. And so, what we want to do, Megan, is actually do something that's known in the industry as squaring the curve. Live long and die fast, rather than living long and dying slowly, having an extended number of years with poor health, poor quality of life. But yes, technically, you're still alive.
And finally, Mike, what do you hope that people will take away from this event?
Well, I hope that they'll take away that they have the power to debunk a lot of the myths that we all have about aging. We all ascribe a lot to aging. Well, you're falling. It's because you're getting old. Your memory is declining. Well, it's because you're getting old. Well, I'm not as strong as I used to be, but it's because you're getting old. And I actually hope that people start to see that they have very small, approachable, and actionable levers that they can pull, things that they can do that will contribute to mediating that pace of what we blame on aging and mediating that pace of what we blame on our lifespan and turning health span into something much closer. So there's so many small things we can do. I want to give you applications in this series.
Mike, thank you again. And once again, tickets are going to be available online. We'll make sure to include a link. This will be June 10th and 11th, Woodburn, Salem, Dallas, and Stayton. Thank you so much.
Megan, thank you.